Hi everyone. A few weeks ago, I shared my panic about my daughter having a tick bite right on the day when my son's summer vacation started. I actually made a Facebook Live. After that, I realized many of my friends were actually not aware of the potential dangers of a tick bite. So I decided to make another video, and in this, I will share about what I did and what measures you can take, and about my insights that I gained upon my research on tick bite and autoimmunity. And if you happen to have a tick bite and develop a potential symptom afterward, some may question my authority to talk about autoimmunity and tick bite per se. I'm a mom of a child with autism who is non speaking, and he was later diagnosed with autoimmune encephalitis. Some may know it as the name of PANS PANDAS. He developed severe symptoms where he lost his speech, started having severe urinary incontinence where he would pee every 5 to 15 minutes. And he had severe separation anxiety, OCD, tics that would wax and wane and changes every fall and spring season. The skills that he gains over the summer, he would only lose it by fall and spring. And it was very cyclic. We visited several doctors to find help for him, and none of them could actually offer us real help to figure out what was going on with him. It was actually that's what caused me to do these learnings and research and learn whatever that I have learned so far to find help for him. So all these researches that I did is for him. And coming back to the topic, ticks are these tiny bugs that are very common, and especially in the North America, it is so very common. But the infection that it causes might not be very, can be more serious than you may think of. It may not be very noticeable sometimes. A tick bite can actually cause what is known as vector-borne diseases. They actually have the infectious agents in their saliva. So when it attaches to a person, it can transmit those infections in the tick's saliva. If the tick is found to be infected, it can transmit those disease to the person who got the tick bite actually. And some of the diseases are called like Lyme disease, fibromyalgia, rickettsia, and Rocky Mountain spotted fever. So if you happen to develop have a tick bite and develop a fever every now and then, and have rash that look like a bullseye rash and all those things, you need to pay more attention and start seeing a Lyme literate doctor. I actually picked up the tick from my daughter's skin and put it in a Ziploc bag and saved it to send it for testing. And I took her to a naturopathic doctor who is Lyme literate. And I got the doctor prescribed her some medications and supplements just in case if she had any infection. And I sent the tick for testing. Unfortunately, what we found was the tick the results on the test on the tick came back negative for all the infections that we tested. So I eventually stopped giving her all the medications prescribed by the naturopathic doctor because we found the tick didn't have any infection. But if the tick happened to have any infection, you should consider seeing a Lyme literate doctor, either naturopathic doctor or medical doctor, because they are the ones who are up to date on the latest treatments that is available to treat Lyme disease or any tick-borne diseases per se. And I just wanted to make sure that she doesn't have to have any other health issues. So I also contacted my homeopathic doctor, her her homeopathic doctor, to get advice on a remedy, and I got a quick response from him. And if you are if you are in a similar situation, I'm truly sorry for you for whatever that you are going through right now. Now you have the information that you need to protect yourself. or your loved ones. And I hope you find this information useful. And I plan to share more such informations. So please keep watching my channel for more such informations. Thank you so much. See you next time.